the biggest thing in the revenue cycle space is focusing on how you can be innovative, whether it is from obtaining copays from patients on the front end or initiating authorizations from an automated perspective. How can we have what we need and really be innovative for our teams and bring ideas to the table?
Welcome to MedAxiom Heart Talk, the podcast where thought leaders come together for one ultimate goal: to continually transform and optimize cardiovascular care for all. MedAxiom Heart Talk starts now.
I'm Cheryl Toth, host of MedAxiom Heart Talk. COVID-19 has flipped healthcare upside down in recent months, and not just in the clinic. The revenue cycle in practices and hospitals is experiencing tectonic shifts as well. Here to talk about the impact that COVID-19 is having on revenue cycle staffing and systems, as well as how CV organizations get paid, is Nicole Knight, MedAxiom's VP, Revenue Cycle Solutions and Consulting. Nicole is joining us from Jacksonville today. Nicole, welcome to the podcast.
Hi, Cheryl. Great to be here.
We always love having you, Nicole, because you bring us wisdom from the field and your experience and wonderfully pragmatic tips and action steps. So look forward to this discussion. So much rapid change, not the typical scenario for revenue cycle teams. What are the biggest challenges that you're seeing revenue cycle teams facing these days, and how are they dealing with them?
Yes, I think the rapid change has caused a lot of the revenue cycle teams to be forced to work remotely, which has been the biggest impact. Mm-hmm. So for several years, coders have been sent home and working remotely, but several of the other revenue cycle positions, such as the AR representatives, those types of folks, have still been located in the central business office. I think with this rapid change, the biggest adjustment has been sending those folks remotely and how to continue that communication with the program or organization to maintain those open lines of communication, while they're also learning about telehealth service billing, having decreased volumes, and all of those things that have impacted us through the pandemic.
Well, and how are teams dealing with those reduced volumes? Is that resulting in reduced staff in a lot of the places you're seeing, or reduced? Are they catching up on old AR? How are they using that decreased volume to an advantage, or what are the disadvantages?
Well, we've seen a mix of things. We have seen where some folks have been furloughed with the decreased volumes, and I think that's been something we've seen in the healthcare industry across not just the revenue cycle, but other areas as well. I think that the way that a lot of folks have handled that decreased volume is to get caught up on any backlog and coding and to really focus on the AR. So what AR can we get collected? How can we shift our focus to ways to bring in revenue when we are having impacts to our lower volumes?
And are you seeing result with like better days in receivable or more AR cleanup, things being written off and gone through with a fine-tooth comb because there is more time? Be curious about that, because I know that that's for large organizations, and many times that there's this AR that everyone's so busy chasing the current stuff, it's hard sometimes to get at that old stuff. So what are you seeing?
Yeah, I think it's been somewhat mixed, because we have some organizations that have done a fairly good job with keeping their AR below 120 days manageable. The ones that I see that are focused on those 90 days or less are the ones that have been really successful in capturing that revenue. Mm-hmm. The ones that have had this older AR that may be over 120 days, and that's really the largest majority of those, is not collectible, and it's just been sitting there but not cleaned up, it becomes more of a cleanup project and not necessarily is revenue generating. But needless to say, you get to start with a blank slate.
Yes.
To help understand how you need to be staffed and what does that look like moving into 21.
Well, so let's talk about the staffing. You mentioned remote. The move to remote has been kind of the biggest thing here. So it's been about 5 months since not just the coders, but some of the other billing teams, the AR representatives, started working remotely. How has it changed the workflow, or has there been any change? And also the performance of these folks. What are you finding in member organizations is the case?
I think for leaders of these teams, it's become a challenge to manage their productivity remotely because it's been so challenging to just get them connected to the organization. So folks who have not been remote and who did not have means of access to their organization system, there's a lot of kinks that had to be worked out from an IT perspective. And it did affect them from a perspective of how is it going to impact their productivity? Are they using one screen now or two screens? Are they on a laptop? All those things come into play when you're working in the multiple systems and have those connectivity issues. So what we've seen is that the revenue cycle team leaders are really focusing on, if we can continue to manage this remotely, what does our staffing model look like? And how are we going to maintain quality and productivity? Because those two are essential to maintaining our revenue.
And do you have any specific examples yet that you're seeing out there in terms of those staffing plans? Anything you can point to an organization maybe that's kind of got their plan at least loosely together? Or is everything still in discussion, would you say?
I would say that everyone is still developing it fully. Some of the things that we've been working on with some of our organizations and the big health systems is how much does the individual biller touch? How much time does it take her to complete that task, and try to back into an FTE number based on what that time is taking? Because in some facilities, they may touch 100% of these types of denials, but in other facilities, they may only touch 80% or 20%. And then how does that impact that continued staffing model? And how am I going to manage that with them being all external, remote? Am I going to be able to have a report from my IT system? Can I look at clicks? Can I look at line items? Because a line item on a claim could be up to 10 line items. So what am I going to judge that from? So I think that is in development still.
Interesting set of new performance management issues, isn't it? Like going into the next year and how this is all going to shake out in different metrics. We don't know where it's going to end up yet, I guess. I'm curious about patient point of service and patient collection. So we know that there's been a lot of unemployment and layoffs and things like that, and folks who've lost health insurance who were insured before. How are you seeing that change the approach to point of service collections and patient collections, pre-procedure deposits, things like that, and how it's addressed in CV organizations out there?
Yeah, so definitely the out-of-pocket of patients has increased, and practices are feeling that. And what I've seen happen in this, it's been interesting to see happen from when the initial pandemic began to where we are today. A lot of those folks, we just didn't even have time to focus on how we would check a patient in from a telehealth perspective. If they weren't physically in front of us, how would we get their insurance information? How would we collect? And I think that has now, what we're seeing is that several folks are using their portals when they might have had only minimal use of those portals. Now they've used those portals to where they can electronically manage that patient's demographics, insurance, collect money via that portal, also using some third-party platforms as well. And then you do have some practices who have deployed a whole team of folks that are doing a virtual check-in where they're calling that patient, they're going through that entire process, and they're taking that information over the phone. So I think we've come a long way in that that's being focused on, probably a little better than we focused on it when we had all of those patients coming into our clinic, because we focused a team on that now, or we've advanced our electronical portals to help support that.
Are you seeing more use of, for example, patient financing being deployed out there to kind of deal with some of the patient collections, given that the patient is paying more of the bill now?
I do think that's a wave of the future. What I would say is I'm not seeing that very much to where they're having these financing options. I know I've seen several companies that offer this, and it's a great benefit for the patients. I'm not sure that they've embraced that yet.
Mm-hmm.
But one thing I thought that I haven't seen in our practices is, there's a credit card option for healthcare that the patient can apply for a credit card without interest for 6 months, depending on what they qualify for. And I've seen actually some of our practices begin to offer those type scenarios that, patients are used to having for maybe their veterinary care or
exactly.
those types of things. But now our organizations in the cardiovascular space are looking at how they can offer that to their patients, because it does help with having that. Another thing has been having a credit card on file and gaining permission to use that credit card on file and going through a whole consent process with the patient has been something also that they've implemented in the practices.
So they would be able to easily do recurring payments on credit
Correct.
card, like paying off of 6 months and $100 a month or whatever it is that it's agreed to. Yeah, you're right. And this actually leads to my next question, because this is perfect. This online payments, use of the portal, e-statements for patients, pay by text. What do you think is going to stick?
I think a large amount of the digital platforms through text and through just online internet access are going to stick. If you look at our elderly population, they're becoming more in tune to using that. I think it's forced them as well to have education to be able to use these resources better. So I think as we move forward, our population in cardiovascular space will be able to continue to utilize the text and the online version. And in this whole scheme of things, the feedback has been, wow, this is a lot easier. Even when you look at the telehealth connections with physicians and really that patient bond, we have seen several success stories of patients being so appreciative to be able to sit on the phone with their physician and see pictures of their family in the background, or just have a connection with them.
Yeah, so we're looking at virtual check-in teams, more automated recurring payments with the credit card on file, maybe more text to pay, higher use of the portal. That is all possibly going to stay. One more question before we move to a break. The telehealth visits, which we all know have been hugely accepted and patients love it, and they've been a real big change. How does one pay for those typically, the patient? Is it through this virtual check-in team? Do they take the money in advance for a copay by credit card through the portal? What are some typical scenarios that you're seeing that seem to work really well for that part?
The ones I've seen work really well are the ones by text, believe it or not, because within that text, there's an embedded link that the patient can just click on. And because they've registered with the clinic from their screening process, they're able to just pay online. And it's become a lot easier. They can use their mobile device, whether it's Apple Pay or Google Pay, and even, have it directly out of their checking account and not use a credit card. So I think they've all liked that technology of that embedded text link.
Mm-hmm. I know I like it when I'm offered it as well. It just seems so simple. We've got our mobile devices with us everywhere, so it's just a very simple way of doing it. So great. Text to pay, probably here to stay. Well, let's take a break. Nicole, you're going to stick with us. We're going to come back and talk with Nicole Knight a little bit more on the staffing and the human resources side of revenue cycle changes as a result of COVID-19. So stay with us. You're on MedAxiom Heart Talk. Good news for revenue cycle leaders and teams who need an easy way to stay informed about revenue cycle changes. MedAxiom has just launched a great online resource. The MedAxiom Revenue Cycle Solutions page features webinars, podcasts, blogs, white papers, and other informational resources. Driven by member questions and curated by MedAxiom consultants, it provides answers and valuable training material for everyone on the revenue cycle team. Find the Revenue Cycle Solutions page at medaxiom.com/revenue cycle. That's medaxiom.com/revenue cycle. We're back and we're talking with MedAxiom's VP Revenue Cycle Solutions and Consulting, Nicole Knight. And we're talking about all of the changes in revenue cycle that we're seeing as a result of COVID-19. Let's talk about revenue cycle leadership, Nicole. With all of this change, digital and otherwise, and remote workers, what does a revenue cycle leader need to be successful in today's environment?
I think from a revenue cycle leader perspective, if I could say one thing, it's the communication. I know that working virtually, you tend to lose that connection with folks, but really having an active communication plan from a leader perspective to keep folks engaged with not only you, but engaged with one another and feel like they are still part of a bigger picture, I think is really important. And some ways that we've seen that work is by using Zoom meetings now. So folks log into Zoom, they're able to use their video and have conversations. So instead of having in-person staff meetings, they've switched to those virtual meetings where they can see one another. Having scheduled touch points individually with your staff, whether it's like a 5-minute touch point once every other month, or just something that can get you engaged with them so that they know that they are still part of something bigger.
I think that's great. I like that the one-on-one touch points because I've worked remotely for a long time, and the Zoom meetings are great, but they only go so far. You still often need that one-on-one, and especially for the revenue cycle staff who haven't worked remotely, that's got to be nice to have their manager, supervisor checking in regularly. That's a good tip. I also want to just mention that something I find when folks move to remote and they're just not used to this, using the CC on all their emails regularly. I think in years past, CC was like, oh, I'm going to just copy you and I'm going to copy the people, and the person who gets the email kind of feels like, oh, you don't trust me to do that thing. Well, when you're remote, it changes everything, because if you don't get the CC, you have no idea what's happening outside of your four walls. So I recently had an incident where the staff person wasn't using CC, and we talked about that as a way of just staying in the loop, like you said, staying connected. What about the staff, and how are they staying connected, and what cultural kind of characteristics do you find are those that successful teams have on them? You know, what kind of things will these revenue cycle leaders look for when they have to hire new folks for these remote roles?
Yes, from a team's perspective, I will tell you it's important to have someone who is focused on the details. Revenue cycle teams tend to be very task-oriented. Mm-hmm. So giving them the details of, I need you to accomplish this task by X, actually helps them. So feeling like you have a deadline and you have a scope of what needs to be done, just assuming they know what to do can tend to cause some frustration within those teams, especially if they're talked to about not doing something they were supposed to do when they didn't know about it. So I would say the biggest challenge is for folks in this space that are very black and white and very task, is to really have a well-defined objective of what you're trying to accomplish and when you want to accomplish it by, and then also providing them with the kudos. They're not a group of people who need kudos often because they're often behind the scenes, right? So they don't receive that often, but they do still need it. So being remote and working in your home or wherever you might be working, it's important to still have that level of a relationship where they are recognized for the job that they're doing. What I've seen with remote staff as well is they're balancing what several of us are balancing with our home lives and everyone being home, whether it's virtual school or a spouse working virtually.
Mm-hmm.
So how are you really helping them with the flexibility of their hours? So, you have to look at, because I think what we're going to see people in this space look for is flexibility. So do I have the flexibility to, number one, know what task I have to complete, the timeline I have to complete it, and do I have a 24-hour period to do that where I can flex my hours? I think those are going to be great selling points for our teams because that's what they're going to be looking for when they're looking at working in this area.
Well, and I want to point something out that you're advising here, and it's so smart. This idea of clarity by the leadership or the supervisor to say, okay, this is what I want, this is what I'd like it by, here are the goals, and here's the framework of what I want from you. So if you're a leader who fancies yourself, I like to give people a lot of slack, I want them to take the initiative, in a remote situation with this particular group of people, with the type of folks that work on billing teams, you'll be better served, it sounds like, if you give them a little bit more parameters around the tasks. Am I hearing you right?
Yes, clear expectations. That's what they're looking for, clear expectations.
Yep. And then once they've got those marching orders, they are just off to the races and very task oriented and want to get things accomplished. So,
correct.
What would you say leaders can do to keep folks up to date on the latest changes? I mean, obviously there's webinars. Well, we have a new revenue cycle solutions page, right? Why don't you tell the folks a little bit about that and what folks will find there to educate themselves and stay up to date?
Yes, so just like any website, sometimes it's hard to identify certain services. And what MedAxiom has done is they've developed a page specific to revenue cycle. So it's MedAxiom.com/revenue cycle. So this helps in being able to find it, and we have our resources that are all going to be housed there. So whether it's a coding tool or it's the latest webcast or podcast, or if it's just some breaking news, we will have that there on that website. So I think it's going to be great to be able to direct people directly there and limit the searching on our overall webpage.
Great. I also wonder, again, with the remote team situation, there is, of course, the Zoom meeting, but what do you suggest for teams that want to stay up to date? I mean, should they be doing a little bit of reading every week, or should there be shared information? How would you suggest they do this in a remote way and share information amongst the team, new updates, new codes, new rules?
Yes. So a lot of folks have developed some either intranet or some type of shared posting, even if it's just an Excel document or a Word document that's on a shared drive, I've seen, where they put down things that have come up or the latest of what folks need to know. So that's one way that I've seen it. I think a big thing for organizations who are active on our listserv is to be sure that if you have staff turnover or if you have new folks that you've added, to please update that with MedAxiom, because being on our listserv definitely keeps you in contact with all of the things that are changing. Having on-demand webcasts available has been really key for several folks. Even on my team, I have some coding folks that support my team as well, and they have been able to use on-demand resources to help. So I may not be able to listen to that or hear what's changing, what's the latest, but I can go back and listen to a recording. So I think having all of those resources available to them is important, especially as we move to the proposed changes for 2021 and how that's going to impact our groups, because it's really hard to think past the pandemic right now, but we really have to start thinking about what's proposed in 2021 to impact us.
Excellent. And a great segue to thinking about over the next 6 months, what should billing and coding staff and revenue cycle staff be preparing for? I mean, what should be on their radar, and how can they make sure that they're ready for 2021?
The biggest thing for 2021 that we know is going to happen, and I would be very surprised if it did not. It did make the proposed CMS rule that was released at the beginning of August, was that our evaluation and management services for office and outpatient services are going to be changing. This impacts our provider documentation. This impacts our coders. It could impact your clinical workflow. So really starting to think about that and how I'm going to be able to operationalize this when January 1st comes around is important. Over the last couple of weeks, we have done a proposed rule webcast, and also we did a webcast diving into those evaluation and management services and the key takeaways of what you can do to help prepare your providers and get them up to speed. Because I think from a coder perspective, this is changing guidelines that have been in place since 1995, 1997.
Yes.
So this is big for us.
Yeah. Yeah. Final thoughts or advice, Nicole, that you have for folks listening today?
Yes, I think it's the biggest thing in the revenue cycle space is focusing on how you can be innovative in this space. We always talk about innovation around telehealth and the clinical space, but when you look at revenue cycle teams, really thinking about how we can be innovative, whether it is from obtaining copays from patients on the front end or initiating authorizations from an automated perspective, but really thinking about innovation, because I do believe as we move through this, through the pandemic, and hopefully to the end of the pandemic, we will continue to be challenged from an innovative perspective. It will not just be paper anymore, similar to our EMR implementation, or if we have all of our coding reference, how can we have what we need from a virtual perspective and really be innovative for our teams and bring ideas to the table?
Nicole, as always, wise and practical advice from you. Thanks for being here and being our guest today on MedAxiom Heart Talk.
Thank you, Cheryl.
And thank you, everyone, for listening today. Don't forget to check out MedAxiom's new Revenue Cycle Solutions page. That's at medaxiom.com/revenue cycle. And if you enjoy the podcast, please tell your colleagues. They can subscribe to us on Apple, Google, or wherever they get their podcasts. If you'd like to give us feedback directly, send an email to hearttalk@medaxiom.com.